Welcome to the deep dive. Today, we're getting into celiac disease. It feels like something you hear about quite a bit now.
It really does.
But, looking at the sources, it seems, while we've learned a lot, there are still some, well, pretty significant gaps in our understanding.
That's absolutely right. And what's interesting is how our medical knowledge has definitely advanced, but it's not the complete picture yet.
Right.
And those gaps, those unknowns, they can cause some interesting ripple effects, especially in, public perception.
Okay, so let's dig into that. Celiac disease. It's fundamentally an autoimmune response, yeah.
Hmm.
Gluten's the trigger.
That's the basic mechanism, yes.
But it's clearly more complex than just like an upset stomach after some pasta. The sources really emphasize a much wider range of potential problems.
Oh, definitely. And that's one of the really fascinating and sometimes challenging aspects, how differently it shows up in people.
How so?
Well, sure, some individuals get those classic gastrointestinal symptoms,
Mm.
bloating, pain, diarrhea, that kind of thing. But then others, they might primarily experience things like chronic fatigue or maybe anemia, even skin conditions like dermatitis herpetiformis.
Yeah.
Sometimes neurological issues pop up too.
Wow. Okay, so that huge variety. That must make getting a diagnosis pretty tricky
It
sometimes.
really can, yeah. If someone doesn't have the typical gut symptoms, it might take longer for celiac disease to even be considered.
And I guess that kind of blurry picture symptom-wise probably feeds into some of the public confusion around it.
I think that's a huge factor, yes.
You hear so much talk about gluten sensitivity, people cutting out gluten for all sorts of reasons.
Hmm.
Does that maybe dilute how seriously people take it when someone actually has celiac disease?
That's a really important point. Connecting it to the bigger picture, these, let's call them misconceptions, they can have real-world consequences.
Okay.
Well, think about someone with diagnosed celiac disease. Their strict gluten-free diet is a medical necessity, not just a lifestyle choice. If people around them don't grasp that, maybe they're not careful enough about cross-contamination, or they question the person's needs.
I see. So social situations, eating out, could become quite stressful or even risky.
Exactly. And on the flip side, you might have people who suspect they have issues with gluten, perhaps based on popular trends, and they cut it out completely without getting properly tested first.
Right, which could potentially mask celiac disease if they then go for tests later.
Precisely. Or they might be restricting their diet unnecessarily, missing out on nutrients,
Hmm.
without a confirmed medical reason.
It's interesting. The sources suggest these misunderstandings are pretty widespread. Why do you think that is? Is it just the complexity you mentioned? The varied symptoms?
I think that's definitely part of it. It's hard for a simple, clear message to cut through when the condition itself can look so different from person to person.
Makes sense.
And also, like you touched on, the massive rise of the gluten-free market for non-medical reasons. Well, it inevitably muddies the waters. It makes it harder to distinguish between a genuine medical need and, a dietary preference.
Yeah, okay. So for you listening, what's the main takeaway here? Obviously, this isn't medical advice, but
But it highlights that our scientific understanding of celiac disease is still a work in progress.
right. And that evolution, those remaining unknowns, directly influence how it's seen and understood or misunderstood by the public.
It's a good reminder, really, to be critical about health information and trends we see. The science is often more nuanced.
Definitely. Where there are still questions within the medical community, like with celiac, it almost inevitably leads to some level of confusion or misconception out in the wider world.
That seems to be the pattern, yeah.
So, thinking about that, knowing that the medical understanding is still evolving, what kind of impacts could these unanswered questions and the public misconceptions they fuel actually have? Both for people living with celiac disease day to day and maybe for society more broadly.
That's a really significant question to consider, the personal impact, the societal view.
Definitely something worth mulling over. Thanks for diving deep with us today.